We've all heard horror stories about therapy. What if I told you the majority of those were misconceptions fueled by inaccurate portrayals and stigmatizing language? Welcome to Normalize the Conversation. I'm your host, Francesca Reicheter, and today I'm joined by licensed mental health counselor, clinical supervisor, and adjunct professor Olivia Verhulst. In this episode, we unravel the misconceptions that often surround therapy and self-care, discover why seeking therapy doesn't equate to weakness, and why you don't need a monumental struggle to benefit from it. We'll also debunk myths about therapists' intentions, the role of the past in therapy, and how self-care goes far beyond face masks and spa day. Join us as we challenge misconceptions, share personal experiences, and explore the importance of seeking help and practicing self-care in your mental health journey. Olivia, thank you so much for joining me today. I'm really excited for our conversation. We're going to debunk some myths about therapy. But before we begin, I really just want to check in with you. How are you really?
Great question. How am I really? I am doing pretty well this week because I'm coming off of my best friend's wedding. So that's kind of sent me on a high for the week. When you're around that much love and joy, it's hard not to be. And I'm also a little nervous for today. Yeah. I haven't done one of these in a while, so that's how I am. How are you?
First of all, I love that you're just coming off your best friend's wedding. I attended my first wedding recently, and it's so fun. I had no idea how fun weddings were. So I love that for you.
Many more to come, I'm sure.
And then secondly, I'm doing okay. I've been really sick the last few days, and I have not had much energy to get up and do anything. I kind of get up for a little bit and then just go right back to bed. But I'm actually excited to record right now. Can't talk well, but I'm recording and I'm excited about it. So that's how I am. Excited to be awake.
Good. Well, I hope you get good rest after this.
Me too.
And I am really honored to be here. I left our initial call together, just thinking to myself how blown away I was by you. You do fantastic work. And I was listening to your podcast this week, just last night, actually. And I thought to myself, you're so transparent and vulnerable. And it's just it's amazing to listen to.
Oh, thank you. And I think a lot of that comes from, I wish I had heard conversations from other people who were just so honest and open about what they went through. Because going through the process, I had no idea what to look for. I had no idea what therapy was like. I had no idea how to find a therapist. I had no idea how to find coping skills that I needed to. I just had no idea about anything. And I wish that somebody out there that I knew about conversations happening. Maybe there weren't, I just didn't know. But I love what I do, because hopefully someone out there is I didn't know that this was possible. And thanks to hopefully me being so transparent, they feel a little less scared in the process.
You and I share a very similar value system. Whenever I have an opportunity to have a more public-facing chat with somebody or go on a podcast or have a conversation like this, it is for that purpose of the more that we talk loudly about mental health and therapy, hopefully the less inclined others will be to suffer in silence. And sometimes people just need to know where to start. And so I'm ready to debunk some therapy myths and hope it can help somebody.
Oh, it's definitely going to help people. It is so important to have these conversations. And on that note, I'm going to read off one of the myths that first of all, you sent over so many amazing myths. And as I was reading through it, I was like, wow, this is what I thought before, going through therapy, before talking to people. This is literally everything I thought. So I'm excited for you to debunk them for us. So myth number 1, that going to therapy and asking for that kind of support indicates weakness, or that one cannot take care of themselves well enough.
Yes. So these myths have been kind of collected in my mind over time. And this is one I have and we all have unfortunately heard many times. And so I wrote a couple notes down because these are such important topics. I want to do them justice. So you might see me glance to the side here. But when people even begin to suggest that around me, that therapy is for the weak or the crazy, I'm like, full stop. The kind of response that we hear when people express that is coming from a really outdated and just fundamentally false place. It lacks formal awareness and education on mental health and therapy, which does make sense because historically it hasn't been spoken about in a way that does it justice. And adds complexity to it. And I find that these comments are also often indicative of people's own issues with vulnerability. And if vulnerability is not a safe or comfortable place for me or strength of mine, it's easy to kind of deflect and maybe dismiss therapy's value via comments like that. I'm interested to hear your input on that after this, but I will say that the people in my life who go to therapy are some of the strongest individuals I have ever met, because to begin therapy is to be brave, because it is to be vulnerable. And vulnerability in this world is certainly one of the most exceptional strengths that you could have for the health of yourself, the health of your relationships. And so people wouldn't be avoiding themselves, and as an extension of that, avoiding therapy if it were an easy thing to fall back on or for the weak. And so, yeah, I think a lot of resistance comes up to doing the inner work, actually, more than it being an easy place to go, unfortunately. So definitely not for the weak. What do you think?
I have to say that I really thought therapy was like for people who were super sick or crazy or whatever the terminology we want to use. And I remember going into therapy the first time, like I was like 12 the very first time I ever went to therapy. And I remember looking around to see if anyone would know like where I was going. And looking back at it, if someone knew that I was going to therapy, they were also going to therapy. So why was I so scared someone would know? No idea. But I was terrified that like something must be wrong with me to go to therapy. And I did not get much out of therapy at that point. But as I got older and I went again when I was in crisis, like post-psych ward, I wish I had gone earlier, because I learned coping skills. I learned how to express myself. I learned how to process what was happening in my brain. And those are all things I could have learned before I was in crisis, right? Because I'm still going through stressors. I'm still experiencing life, and there's so much happening, and I need to be able to cope. I need to be able to do self-care practices. I need to be able to talk about what I'm going through. I needed all these skills. And yet I thought that I had to be in a place of like complete, at a loss, defeated, hopeless before I reached out, when it would have been so much better to have reached out before. So you don't have to, something doesn't have to be wrong for you to go to therapy, and it doesn't make you weak. Going to therapy takes so much strength because you're willing to grow, and growth is scary. Like it's scary to change.
I could not agree more. The way that I talk about that with people is, if you think about it, to have the courage to literally look inward and address behaviors and thought patterns and defense mechanisms that we've had for years, that have allowed us to even survive in certain situations that may no longer be helping us at this point in time. It's incredibly brave, and going to therapy is taking care of ourselves, and it's also taking care of people that we love. And so I love that you're able to access that now and talk to your 12-year-old self a little bit there.
Yeah, I remember just looking back after like not my first session. I did my first few sessions when I was 20, post-psych ward. And like, wow, I wish 12-year-old me wasn't so afraid of people finding out, wasn't so afraid of kind of growing and changing and learning new things. If 12-year-old me just actually sat there and was willing to talk about it and I was a little bratty about it too. I remember this one question. I will remember this for the rest of my life. the therapist had asked me, she was trying to get to know where like my thought pattern was. So she asked me, would you rather be, I was struggling a lot with my body image, and I was struggling a lot with anorexia. So I was constantly just very, very sick. And she asked me, would you rather be poor and pretty or rich and ugly? And without a thought, I was like, I'd rather be rich and ugly. I'll get plastic surgery. And like, that was the thought in my head at 12 years old, because I thought I had to change everything about myself. I wanted a nose job. I wanted like my cheeks tightened. Like I wanted all these things to change about who I was. I was like, well, if I just had enough money, I could make myself look however I wanted.
Right.
And right, but like that's not a good like starting point, like automatic thought for a 12-year-old. And I wish I could go back to like that 12-year-old self and be like, no, like learn to love yourself. Like just if I had learned back then to love myself when I was in my like teens, maybe I would have wanted to eat more and feel more energetic and feel more alive and not feel like I needed to pass out every single day of my life to feel like I was good enough.
I'm so thankful that you'd share that with me here and with your followers. I know that you're on track to become a therapist or a counselor. Is that correct?
Yes.
I don't know if you've looked into inner child work yet or learned about that, but I can only imagine based off what you just shared that you're going to help a lot of people in this field.
I hope so. I wish I could remember what my classes were, because I just looked at this like 5 minutes ago. I was so excited because the semester's about to start. And I love every class getting to learn something. I was like, wow, I wish I knew that before. So amazing, by the way. So much respect for the therapeutic field. Amazing.
Me too.
I can't wait to join it. But let's move into myth number 2.
Yeah.
So this really builds off the first one, that you need a great big reason or severe struggles to go to therapy, and that your therapist expects this.
So this is a topic I feel so strongly about, and I have spoken pretty loudly about, because it is a pretty big misconception that limits people from getting this valuable support. You touched on a few of these points already before, which was awesome, but of course, we want to have some purpose entering into the therapy experience to help guide the treatment. But the good news is that you do not need a great, big, ugly reason, a severe condition, or to be on survival mode to seek therapy. In fact, we go so far, of course, as to recommend that you don't wait until you're at survival mode to seek therapy. And yes, your therapist will be aware of this. So I would say that you will likely never step foot in a therapy room, hopefully, I should say, where you share about your experience of either feeling stuck somewhere or curious about yourself, or maybe you're wanting to work through one habit, or maybe you're sad sometimes and you don't know why, and have a therapist say back to you, that's it? That's all you got? Like that will, that's not happening in the therapy room. And so people come in really for all different reasons. And, hopefully you're with the right fit of a therapist that can respond to your reason appropriately.
Yeah, absolutely. I mean, you can go to therapy for so many different reasons. If you are just struggling with a life choice, right? You don't know which path to take. That's a huge like support system that you can have, someone to talk it out with, to listen to you. I know that for me, like I always struggled with this idea of feeling like I was burdening people by talking about what's happening in my life, calling people and being like, I could do this or I could do this, and like venting it all out to them. And first of all, like usually people are pretty excited to hear me vent to them because I'm pretty like funny when I vent. I don't know why I use humor as like a defense mechanism. I should work on that in therapy, but I do. So I'm pretty entertaining, I'd like to think. But also going to therapy and talking about it with a therapist and having them ask me the right questions, right? Because the therapist isn't going to tell me what to do, but they're going to help me, guide me in the direction of figuring it out for myself, but asking me those questions that maybe my loved ones just wouldn't know to ask.
Yep. And that's another myth buster we can throw in that wasn't on the list, that therapists are not advice givers. So very, very good point to make. I generally say that the human condition is criteria enough to seek therapy, because to be a human is hard as hell sometimes. So it's a difficult experience at times. And so if you're living and breathing, you have met the prerequisites to go to therapy. And I will actually add to that and say other prerequisites would be we need a willingness to be in treatment. We need to be open to the process and open to the idea that therapy is work. It's a commitment. So I think if you're living and breathing, you're open to the process, you're willing to show up and do the work in therapy, you've met the criteria. What do you think about that?
Absolutely. And that willingness to change, that willingness to try, being open, I think that a big thing people think of therapy is that they're just going to sit there and it's going to happen like all at once, right? Like your therapist is going to tell you what to do and that's it. And everything's going to change. You have to be willing to open up and be honest. Like lying in therapy is a big thing because, you know, people are afraid to be honest. Like, how's the therapist going to react? Or, I don't know if I can trust them, right? So we often like to lie in therapy or omit pieces of the truth. So being willing to be honest, I think is a huge one.
Absolutely. And I think you and I touch on a little bit of that topic a little bit later in one of our myths. And so we will definitely circle back to that.
Let's move on to myth number 3, that just because you're not diagnosed with a mental health condition, you are mentally/emotionally well.
Yes. So an absence of a mental illness or formal diagnosis does not necessarily translate to you are in a good or thriving place emotionally and don't need or can't benefit from support. And likewise, just because you are what people like to refer to as more high functioning in their anxiety or depression, maybe it's that more silent or smiling depression type. If you've heard of those terms, just because it doesn't look like depression maybe we've seen in TV. It's hard to get out of bed, low motivation, we're isolating. That doesn't mean that you're unworthy of support. So in conclusion here, emotional struggles, academic and professional struggles, relationship struggles, they definitely do not look one way or one specific way that's going to qualify you for therapy.
Yes, and going back to that silent depression, a lot of times we can't necessarily see it on someone like we think we can. I know in the media, it's like all of a sudden it's that massive change in someone's personality and appearance.
Right.
And a lot of times people are good at putting on that face, putting on that smile, showing up in front of people. And then when they're alone behind closed doors, it all changes. And I know for me, that was the reality. I was like the most bubbly, high energy, like happy person in the world. You would have had no idea I was struggling unless you saw the breakdowns happening in the middle of the night when no one was around. How much energy and effort it took for me to want to get out of bed. But people didn't see that. They saw the person getting up at 6 a.m. excited for life and to go to the gym and then go to class and do very well and perform high. They didn't see everything happening inside and behind closed doors. And I think that's a big one, that just because you're able to put on that face doesn't mean that you're not struggling. It just means that you're kind of overcompensating for it, not wanting people to see, and you deserve to feel supported, whether or not other people get to see that piece of what's happening.
Really well said, Fran. I think it's a lot more common than people think. To be putting on that face. I mean, we really have to, I hope that we can all begin to walk through the world more with the understanding that we don't have an understanding about what somebody's going through at a given time. Like, you know, I think that that's essential.
You can't see inside someone's mind, and just being willing to be kind. You never know what someone's going through, and just kindness. Kindness is key. I hope people learn that. Just be kind. Let's move on to myth number 4, that psychiatry is a replacement for psychotherapy.
So in your training so far in your classes, have you guys touched on this topic? And do you have any Any insights, any opinions on that before I go?
So I will say I'm about to take psychopharmacology this semester, and I'm excited for that. But so I see a psychiatrist and a psychologist, and the big thing that I learned is the psychiatrist is there more so for, I don't want to say just for prescribing medication, but they work a lot in tangent with the psychologist to see what you're going through and then help you find medication that may work for you, versus a psychologist is more psychotherapy, talk therapy, and building those kind of essential skills you need. So they can work really well in tangent, but they don't replace each other. If you need medication, your therapist is not going to prescribe it. And if you need talk therapy, I know there are some psychiatrists that do both, but a lot of them do more so the medication, and they work in tangent with the psychologist to make sure that what you're telling them and what they're seeing line up.
Yep, you are on it. I'm actually constantly coordinating care with psychiatrists for patients to make sure we're on the same page and offering the best care that we can to our patients at the consent of our patients, of course. And so psychiatry and therapy absolutely serve different purposes, and are actually incredibly useful in conjunction with each other, studies show, particularly for depression. And for example, I actually once had a mentor suggest that when we are significantly struggling emotionally, which can make people a candidate for psychiatry, obviously, if their symptoms are impairing their ability to function as normal, that getting on the right medication is what gives us the floor to walk on to be able to do the inner work. My old supervisor used to suggest that. So if we're too anxious to get in the car and drive to therapy, or we're too depressed to get out of bed and pursue healing, we're not going to be able to receive help. And so medication management can be profoundly relieving for symptoms, for those struggling who can benefit from it, who need it. But it's not going to teach you how to heal through childhood wounds and create healthier relationship dynamics in your life, and work through anger issues or communication struggles. And additionally, there is research that shows medication and therapy are more effective together, like I said before. And at the end of the day, medication can really help people return to their normal baseline functioning and feel more like themselves. And then therapy is what can help explore different parts of ourselves and understand ourselves better, and really what is limiting us and creating pain in our life.
Absolutely. I take a mood stabilizer, and before taking that, I was really down in like these really deep depressions, and sometimes I'd go up, but I have bipolar depression, so it's depression usually. And the mood stabilizer helps me kind of get into that middle piece where I can function enough to not be in bed all the time crying, to not want to hurt myself, to just get to a place where I'm like, okay, now I can think about what coping skills are available to me and use them. Now I can actually talk about what I'm going through instead of crying hysterically, not being able to process anything happening. So did the mood stabilizer fix everything? Absolutely not. Did it get me to a point that I could go to therapy and get the skills I needed so that I can be at a baseline at a minimum, but actually be feeling pretty good? Absolutely. So I love that. And I don't think that's talked about enough. A lot of people think, oh, medication is like, I'll take an antidepressant, I'll feel better. But it's like, it can help, but without the skills that we need and the tools, it's not long lasting, because stressors are gonna happen. Things are gonna happen. If we don't have the tools to get through that, no amount of medication is going to make it so much easier and just fix it.
Yeah, absolutely. And good example.
Thank you. So let's move on to myth number 5, that you will share something that will disgust or shock a therapist in a way they can't handle.
So have you heard this myth before, or have you heard this reaction before to therapy?
Yes, I have. And I think going back to what we were saying earlier, this is why people lie in therapy. They're so afraid that the therapist is going to be like, oh my gosh, I can't believe you said that. How could you do that? Like, they've heard it all before, by the way.
Yeah, and you know what? I have so much empathy and compassion for those people that they even struggle with that thought. I'm assuming that they're must be a lot of experiences in the past where maybe they have received that type of messaging or reaction. But at the end of the day, your therapist is highly trained to greet your worst moments that you share with us with curiosity and compassion. That's where the work is, really, to be able to aim those same things toward yourself. So we're not going to let an opportunity pass us to do that work with you by showing judgment or disgust towards you. And in fact, when a patient feels that type of pervasive shame around something in their life or a story that they may have about themselves, even, I do consider it actually to be one of the greatest privileges to be trusted with that information, to sit in that with them, more than I have any experience of shock or disgust or something like that. And I do often remind the people I work with that nothing you can say here is going to be something that I can't handle emotionally when you share that with me. And so, side note, I did read something like this in a New York Times article recently, that your deepest confessions are your therapist's 9-to-5 job. And I thought that was very silly. Obviously, it's very playful. We don't want to dismiss the deep vulnerability that people put themselves in to share these experiences, but also I can see that playful comment maybe helping someone out there, that we are, again, well-equipped for what they have to share.
Absolutely. I have, so like my mentor and close friend, I was struggling recently, a couple months ago, and she was like, you can tell me anything no matter what you say. First of all, I've probably heard it before, and it's not going to be the first time I hear something. And second of all, like, I'm not going to change the way I see you just because you're struggling and going through something. And I think that a lot of times people in our lives may react a certain way because they haven't heard something like that before. They don't know what to say. They don't know how to respond. And we may think, oh, everybody is going to respond that way. The therapist, if you have the right therapist for you, if you have the right therapist, like that is also key. If you have the right therapist for you, they are so going to be willing to be there for you, to support you, and to make you feel heard and valued. They're not going to make you feel terrible about something you're going through. Their goal is to help you and support you. Their goal is not to make you feel ashamed and make you not want to grow. Like, their genuine goal is to help you grow.
Absolutely. I think the therapeutic fit is where the work really begins and ends. So if we are having an experience where we're feeling like we are being judged chronically by a therapist, it's not the right therapist for us.
Yeah.
And I did want to circle back to something you said. I thought it was really valuable. This idea that that your friend gave you this messaging or something where nothing you can say will change how I feel about you. What a wonderful message for us to be giving our friends, even like putting therapy aside. Just in how do we create a safe space for people to share? That's awesome. Nothing you can share with me is going to change how I feel about you. That's a great container.
It is, because people who love you, they're not going to be like, oh, I don't want to be friends with you anymore because you're struggling. I mean, I'm sure there are really bad things that people may not respond great to, but if you're sharing something that you're going through, like, I want to clarify, like, if you say that you hurt somebody in like a very violent way, that is very different than saying like, I'm struggling with something, or I'm going through something, or I made a poor decision, right? So, but if you're going through something and you're struggling and you need support, your loved ones, they're not going to see you as like weak and not good enough because you're going through something and you're sharing it with them. Right. Hopefully your loved ones are going to offer support and validation, or they may not know what to say. And hopefully at that point they'll say, I don't really know what to say, but I'm here for you. How can I support you? And I think that's a beautiful thing. If you don't know what to say, totally okay. But just being there can make all the difference.
That's a great picture to paint, and a great disclaimer, right? We're really hitting on and talking about a shame that accompanies struggle, emotional struggles, and the stories we have about ourselves, and some of the worst thoughts that we might have had and experiences. We're not talking about people who are hurting other people or putting other people's safety at risk, of course.
Yes.
Yes.
Always love those disclaimers.
Yep. Yeah. What do we have next for our myth?
I think this is number 6. But
Okay.
that therapists have the following MOs: wanting to keep you in treatment as long as possible, to blame everything on your parents in childhood, and that we like to fixate and dredge up the past.
Mm-hmm. So therapy, when done right, is designed for you to eventually leave. And there is a caveat there, of course, I'll circle back to that. And it involves people who enjoy therapy for ongoing maintenance work, particularly patients with complex trauma histories, or anyone really. Maintenance is a fine reason to be in therapy. But further, I have peers in my network who are therapists who will even let their patients know in the very first session, this space is designed for you to learn tools to feel confident enough to go out there in the world and use them on your own without me. We're not tricking you into being dependent upon us. That is not our MO. and further, we do operate with a code of ethics to not harm our patients, exploit, or take advantage of them. And then the next one you had, I think, was we don't blame everything on, we're not here to blame everything on your parents. What do you think about that?
I think that a lot of times people think, oh, in therapy, they're going to sit there and tell me like, oh, because my parents did this, that this is what's wrong. And a lot of parents see that and they're like, don't want to let their kids go to therapy because they're afraid they're going to be blamed. So I think there's like 2 sides of that.
Right.
And first of all, like there may be some things that maybe your parents didn't support and validate you, and you're struggling with that today. That's not, it's your parents' fault. That's it. You can't grow. You can't heal. It's just them. That's never going to be the case. But it may be, this was kind of like an example that you saw.
Mm-hmm.
So here's how you can work through that and overcome it. But it's not to like blame your parents and be like, well, that's because they didn't care about you. It's never going to be like, this is their fault. That's it. They're the problem. That's it. It's going to be maybe like you were shown something, or something happened that you maybe didn't get a great reaction. That may totally be the case, but it's not, it's your parents' fault and that's it. And I think a lot of people think like that's what they're going to learn in therapy, that they can blame it on their parents.
So there's a lot of good points there. I mean, and so we kind of have to be able to hold 2 truths at once here. One is that no, we're not there to create anger at your parents, and you very well may not be angry at them and may have this really healthy childhood and really resolved experiences. And right, dialectical thinking, we can hold multiple truths at once, therapy skill. Therapy is also a safe space to tap into the unresolved and unconscious anger toward loved ones that ordinarily might not be available to us in our defense structure. Maybe we don't have the availability to tap into that. So that might be why you hear that some people in therapy are doing work around getting in touch with unresolved childhood experiences or anger toward family members, because if there's a place to do it, it's therapy. But that's not all we're doing.
Exactly. And sometimes like some of that anger or fear or pain can be so beneath the surface that you don't realize it. And therapy is a great way to process and express it instead of maybe directing it inappropriately at them. I feel like that's a big one. And 2,
Yeah.
I wish like that the answer was like, it's your parents' fault. So I could be like, oh, it's your fault. Now you need to pay for what you broke. No. My parents are like, that's literally something I would say. But like, I wish that was the case. No, it's not. I mean, there are some things that like maybe you can be like, you can pinpoint to a specific experience. I'm not saying it's just parents. It could be from any type of relationship in your life. There may be things you can pinpoint to a specific experience. Absolutely. But that experience is not something that we're trying to put anger toward. You want to heal and grow. Again, going back to therapy is about healing and growing. So maybe recognizing when something or someone in your life or some experience has maybe caused you to feel a certain way. But we're not going to sit there and push anger toward feeling that way. The goal is to resolve why you felt that way how maybe that's impacting other pieces of your life and other relationships, and how you can grow beyond it.
And to piggyback off of that, the fact of the matter is a lot of our formative experiences over how we were introduced to the world and relationships and ourselves were in fact through parental figures. And so that might also be why when you hear therapy, you might think parents in some capacity. But again, everybody's family dynamic looks different. Everybody's experiences are different. Everybody's psychology and presenting issues and reasons for being in therapy is different. So I guess we're really getting at this idea that therapists don't have a hidden agenda with you.
Yes. That is a big one. I think, going back to what you said, like people think therapists are just trying to trick you to sit there and just they look at you like a dollar sign, right? I think that's like this idea people have that they just want you to come back every week and they want to kind of feed off of your pain or trauma. Like that is not what a therapist does. First of all, people don't go to therapy for the money. First of all, the amount of debt and money it costs to become a therapist, it's a lot, by the way. Throwing that out there. Someone work on that. I don't know who's in charge for how much school costs, but let's work on that. But a therapist is not, their goal is not to cause you pain. It's not to sit there and make you want to come back every week in the sense that you're not able to, that you're codependent on them. The goal is that maybe you look forward to coming back to grow and to change, and you get, don't be like change in a bad way, but like to grow into who you're meant to be and to have the skills. So then one day you don't need to go to therapy when a stressor happens, or checking in with therapists, following up. That maintenance can be key. It doesn't mean you have to go every single week or multiple times a week. It may be like, hey, I went to therapy in the beginning 4 times a week post psych ward. Then it went down to eventually I got to 1 time a week. Great. Then it was like maybe once every other week. Then now it's like every once in a while when I need to check in, when maybe something's happening, or just like, are you still coping well? Are you still moving forward? Are you still taking your medication and feeling like you have the skills with that medication to keep going? Or do you feel like you need some extra support? So therapy isn't this thing that's focused on causing you pain and keeping you stuck somewhere. Therapy is literally meant so that you don't have to come back to us. Like we would love for you to. I mean, I feel like people would love to check in with their patients and see how they're doing. Absolutely. But the goal is not to make you come back every single day for the rest of your life.
I'd love to hear just a snippet about, so what is it like for you to have graduated therapy in some different capacities, and when you go back for a check-in session or whatever it may be, how are you greeted by your therapist, if you're comfortable sharing? Is it a utterly shameful thing, or is it you're welcomed back into this space?
Yeah, my therapist is just like, how are you? How have you been? What's been going on? Kind of like a friend, right? Like they're checking in a way that's like, I'm excited to talk to you. Tell me what's going on. And it's like, okay, it's a safe space to explore what's been happening. And maybe the therapist like, that's great. Everything's going well. Or you know what? I noticed that when you talked about this, you maybe put your head down a little bit, or you kind of like flinched away. Is this something that's bothering you? Do you feel like you have the coping skills? Do you want to talk about it? And kind of go from there. But it's not like something's wrong with you. You need to come back every single day. It's like, what's going on? How can I support you? How can I be here? It's not like, you should have been here every day, or you should have checked in earlier. It's like, I'm so happy you're here. How can I support you?
Yep. I'm glad that you have a positive experience when you go back.
Me too. Really helps. All right, let's move on to the myth number, I don't know if this is 6 or 7, I lost count, but that you will enter into treatment in desperate need of help, only to be met with therapists that nods along for 45 minutes, silently offering nothing back.
So I've heard this so many times, which is why I offered an opportunity for us to kind of process through and debunk this together. That therapy is going to be this kind of mysterious space where you're going to have someone, you're going to be talking for 45 minutes and have someone else across for you going, For 45 minutes scribbling on a notepad. That is not true, although I totally am a lot. But no, I think absolutely a lot of therapists do like to create a very dynamic approach in the room and have treatment be collaborative, and do believe that first and foremost, there are two humans in the room relating to each other. That is what I operate off of in my treatment with folks. And without that kind of relating to each other to some capacity, there's really, the rapport can be quite limited, and thus the therapy can be quite limited. And so what I do want to know is that silence can be a very valuable and intentional tool used by therapists. Silence can be wonderful. Silence can be uncomfortable. It can be many things. But this idea that you're going to go into treatment and get nothing back, and it's just going to be you talking and someone purely listening, is not necessarily the case. That's not to say that you can't take up as much space as you need to as well.
Yeah, if you need someone to just sit there and listen and talk for that 45 minutes, a therapist is not going to interrupt you and be like, okay, don't talk anymore, right? Like, they're going to give you the space to explore, but they're also not, like, therapy is not just sitting there talking and someone just going, yeah, okay. Or I think that another thing people think is the only thing a therapist is going to say, and how does that make you feel, right? They think like that's the extent of what a therapist is going to say. No,
Yeah.
it's not.
Not this therapist. Yeah.
Maybe on TV, but that's about it. Yeah. I really want to go back to that silence. So that was one of the first things we learned. And I think it's like theories of counseling. You have to be comfortable in silence. You don't want to fill the silence right away, because sometimes the silence gives people a chance to just process. So when a therapist is silent, it's not them judging you, right? Like, I thought like, oh, that's them judging you and them trying to figure out what to say, whatever. No, it's a therapist giving you space to process and to kind of understand what you're feeling. And then you guys are going to talk about it, and maybe they will fill the silence. Maybe they'll let you be the one to respond first. However, silence isn't your therapist judging you. And that's what I thought it was until my teacher explained that, like, no, sometimes you just have to let that silence exist for a little bit.
Yeah. Oh, I love that you were able to learn that and kind of have that light bulb go off for yourself. It's absolutely true. And I think you said it perfectly.
Yeah, if you want to debunk myths of therapy, become a therapist and go to school for it and learn all these things that you thought there was all false. That's what I learned. It's like everything I thought.
Therapist.
Yeah, that is true. Maybe you don't have to go spend a lot of money to learn the myths of therapy. You can ask your therapist. You can listen to this podcast episode.
Yes.
That's great advice, by the way, clearly.
Oh, that's funny.
Okay. So, next myth. Let's see. There is one gold standard version of effective therapy in general, or that there is one universal treatment for certain issues.
Yeah, this one's quick. I would just challenge that and say, well, how could that be true, right? We're all uniquely complex beings. We all experience and thus see the world differently, and thus respond to different techniques, modalities, personalities. And so there's definitely not one gold standard approach or type of therapy that's going to help everybody for every issue.
Absolutely. And I remember one of the first, like our first conversation, I even asked you about like, how'd you choose which modality was right for you? Because I had taken a class and the teacher was very much not really engaging in discussions in therapy. It was more let the client lead and maybe respond a little bit, but really let the client lead and don't have any kind of discussion. And I'm very conversational. So for me, it was like, I really enjoyed being able to have a conversation with the client, being able to ask some questions and make it more interactive. And you said that it's different, like different therapists take different approaches. And I was like, yeah, that's true. Like there's a reason why there's not one modality. There's a reason why we're learning all these different theories. It's not for fun. It's
Yeah.
to see that there's different approaches you can take.
And we need therapists to bring themselves in that way into the room, because people need different types of care. So I hope you find your way, and I hope you fall into a rhythm that feels really good to you.
Oh, me too. I can't wait to go into practicum. I think next semester I take pre-practicum, and then I go into my year practicum, and I'm so excited. I can't wait to figure out like what's right for me and get to actually experience being on the other side of therapy and not being the client, getting to see what it's like and it feels like to watch the client grow. I'm so excited.
A very special time. I just taught practicum, and while the nerves were palpable, so was the eagerness and the excitement and the first moments of wow, fulfillment, and so I wish you luck.
Thank you. And I think it's great to point out with this that people don't just become therapists and you're not like their first client and that's it, and they've never had any supervision. Like they've gone through supervision, and they have, especially a new therapist, has people to talk it through with. And even therapists who've been doing therapy forever, they communicate with other people and grow and learn from each other. It's not just like they know everything and that's it, and they're not willing to grow and learn. Your therapist is always growing and learning, just like you are. And I think that's so important to realize, that you're not having someone who's completely untrained and has no idea what they're doing. Like they've gone through a lot of supervised work too, and have had the chance to ask questions and collaborate and grow. It's like, it's really important. Therapists grow too.
I love that. You're not sitting with someone untrained who's not an expert, and you're also not sitting with someone who is perfect and who is all knowing. And that's something to also remember about your therapist, that you're sitting with a human.
Yes.
Sometimes that's kind of just useful to remember. I know we have, I think, 2 more to debunk before I actually am going to be popping into session soon.
I'm excited. All right, next one, that therapy is the only way to heal through issues.
Yeah, it's not. No, I mean, I like to be really clear with people that by no means do we believe, or do I believe, I should say, that therapy is the only way to take care of your well-being. Spiritual practices, community care, support groups, mind-body care, yoga, exercise, really good friends and family are all ways that we can take care of ourselves and our mental well-being. Therapy just happens to offer a specific setting and space dedicated to the inner work with a non-biased trained professional, but that's not what everybody is necessarily open to, looking for, or needing in their journeys.
Absolutely. Therapy is one of many options. It's a great option, but it's not the only option. And there may be better options out there for you, or therapy may work great with other options as well in tangent. So it's not a one or the other, and it's not the only option. So hopefully everyone gets to explore what works for them, and know that it's okay if the first time you try yoga, you don't like it, and then you try with a different instructor and you do. Same thing with therapy. It's okay if the first time you meet a therapist, you're like, oh, I don't like this therapist. Therapy isn't for me. Hopefully you get to experience a different therapist and say, wow, maybe this one has more of a personality that I connect with, or a modality that's right for me, or they just respond in a different way. Maybe it's just a different environment. There's so many different things that can impact how you feel. So if you wouldn't give up on yoga after one session, I really advise you try therapy more than once. But again, if it's not right for you, that's okay too.
Fran, I love this. I've actually had this conversation with both friends and patients, more generally, about this idea of, I tried therapy and it wasn't for me. If we could kind of play with that thought a little bit, is it possible that we tried therapy with a certain therapist and maybe the therapist wasn't for us? Or is it therapy? It's a useful check-in question to ask.
Exactly. And you don't have to be willing to try with a million therapists, but I'd say I like to try at least two. Personally, for me, if I didn't like the first one, I always tried someone else and just saw maybe a different environment, maybe a different personality, maybe a different modality. Maybe just one small change could make a difference. And for me, that's really helped. It took me a while to find a therapist that was right for me, or I had a therapist and they were great for a while. And then I outgrew what I could learn with that therapist because my needs were different, what they specialized in. I had enough coping tools, I was able to graduate from them, but maybe I needed another type of support, and that's okay too. So just, I think being willing to explore is so important, and knowing that it's not the only option and doesn't have to be a standalone option either.
And being willing to evolve. I love that point of sometimes one professional is going to serve a certain purpose in our life for X amount of time. And because we are ever evolving, so are our needs. And so maybe a different type of therapist approach or whatever will benefit us at a different time. And so great point there.
And then our last myth, and this is on self-care. So this, I mean, I loved all these myths, but I'm really excited about this one because I had like the biggest misconception on self-care up until like a year ago. But that self-care rituals like a face mask, a candle, a spa day, eating chocolate that you usually would say no to will be critical to help maintain your mental health.
Yes. So that's a common one. I actually just talked about this recently in an interview. Yeah, the term self-care, you're not alone. It's begun to lose meaning over time and kind of get diluted into this world of quick fixes and indulgences and things or events. And I actually find it much more effective to conceptualize and talk about self-care as a process by which we are making highly individualized decisions to take care of ourselves based off self-preservation and empowerment. So we want to think of it a little bit more as a foundational experience and a template to work off of that help maintains our well-being more than it is, I did a face mask and I did self-care. So really what we're talking about within that more foundational realm and part of our template for self-care is stuff like boundaries, investing in relational health, which is one of the biggest protective factors for our mental health. You might be learning that in your program. And also we want to be thinking about our bodies and minds' basic needs, hydration, movement, those things.
Yes, because if face masks and chocolate cake were like self-care and that's what healed you, I would have been healed so early in life.
You know, we'd be in a healed world. That'd be awesome.
That's all I needed. I would have been great. But no, and it's a lot with intention too, because a face mask may be something great with some intention behind it. Maybe I am taking the 15 minutes with the face mask on to do some deep breathing, or to just relax, maybe take a quick nap. Just the intention behind it. So it's not to say that a face mask can't be incorporated into self-care. It's to say that just doing a face mask is not the whole thing of self-care. Self-care really comes to intention, and it can be taking a spa day. Okay, but what's the purpose behind that spa day? Is it a day to just relax and to get connected to you, to maybe reflect on relationships and how you're feeling, maybe focus on some boundaries that you've set for yourself? So not to say that these really fun practices that we've come to think are self-care can't be part of it, but it's not the entire thing, and that's okay. So really focusing in on that intention, and know that just because you did the work for an hour does not mean it's a quick fix. It's not a magic pill. It's not a magic pill. It takes time and a lot of different tools. A face mask, chocolate cake, even changing one boundary is not going to solve everything. That's okay. It's not a magic pill.
Perfectly said. What is our purpose? What is our intention? Are we trying to be in more of a practice of nourishing our body and not restricting from things? Then that chocolate cake might be a part of your self-care process. Are we, in a process of learning how to prioritize ourselves more and take me time? And maybe during that me time is a nice bath, is a spa day. So I loved what you said there about purpose and intention. Thank you for adding that.
It's just so important. I wish it's something I knew earlier, but thank you for debunking all of these myths for us. It is so important that we have these conversations.
It was my absolute pleasure. Seriously, thank you so much for having me, Francesca.
Of course. So we're going to wrap up with one final question. What is something that people would be surprised to know about therapy?
So something we touched on earlier is the therapeutic alliance and fit and finding the right therapist. And something I do like to remind people or just spread the message on is that the effectiveness of therapy is really, it coincides more than it does with the modality or approach used with the strength of the therapeutic alliance and the strength of the therapeutic relationship. And so that's something to be taken really seriously, is our relationship that's developing with our therapist, because that's going to really dictate the quality of the work and the outcomes that come your way, in my opinion.
Absolutely. And that was one of the first things we learned it was a class about creating a treatment plan, right? It's building that rapport. That's one of the most important things, is that therapeutic alliance, because when you feel like you can trust your therapist, when you feel comfortable being open and honest and exploring who you are at your most vulnerable moments, that's when real work happens. That's when growth and change happens. So making sure that you feel comfortable in that relationship is key. And that's a two-way street with the therapist and the client.
Right. Your therapist should be able to hold all parts of you.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.